Okay, many of you have asked me how I rehabbed my knee so quickly after I had a knee operation. So in January of 2024, I went in to have some minor keyhole surgery on my right knee, where I had some floating cartilage in the joint, and on the back of my kneecap there were gaps where there was no cartilage. So I had an operation where they took out the floating cartilage, they drilled some small holes in the back of my patella, which encourages blood flow and then encourages more of a growth of cartilage. The operation itself took maybe 40 minutes, and then within 6 weeks I was back running, and then I ran a half marathon at the end of March. So it's totally possible. I'm going to share with you some of the things that I did. I trained as a sports massage therapist with rehab, so I already had some of the tools and I knew what I was going to be doing. Obviously you just consult with your own physician, definitely work with a physio where you can. Day one of the operation, whether you can sit or whether you're lying, what you want to try and do is just move your leg, okay? So the muscles around your leg can still work. Even if you can just pull to here and back down again, that's what you want to be doing. So I was doing about 10 of those every couple of hours. This also helps to prevent things like DVT, deep vein thrombosis, and it will stop your knee from seizing up, because after a lot of these operations, that's usually what happens. You rest, you don't do anything for a long time, the joint becomes stiff. So I was just moving as far as I can, and then the next day I was trying to pull. So I wasn't doing it on my own, I was using my hands and pull all the way in and then gently lowering it back down, okay? By day 3, I could actually do the whole movement up and down. So by about day 2, I would say, after the operation, you're hobbling around, you're standing. What you should try and do is hold on to something and try as much as you can to lift now against gravity. Before on the floor, we were kind of moving in this movement. Now what I was trying to do is lift from about here. I was also trying to do some backward leg extensions as well, so keeping the strength up in the glutes and the hamstrings. So bending and straightening. By day 4, 5, I was able to bring it all the way up. So you will know the range of motion, but really you're just trying to get that range of motion back and keep it. By about day 5, 6, I was walking. So I was trying to not use the crutches as much as possible, but by day 4, day 5, I was not using them at all. By day 5, day 6, I was walking, right? I was trying to walk through that full range of motion again and making sure I was keeping my knee moving. Once you get to that stage, so stage 3, you're gonna try and get a set of bands. So I got a set of about 4 bands. These are the smaller ones. You can also get the much longer ones, which again, you could tie to something. But really the idea is that you can use furniture. I just used my other leg. You're gonna put your leg in, and then you can see the band on the bottom here. I want to again strengthen all these muscles around my knee. I was doing some extensions this way, and then I could do some kickbacks like this with the band. And then you can also do side, and then you can also do across, okay? You can also do the ones lying on the floor. So the idea of this is I'm trying to build all of those stabilizer muscles around my knee and hip joint, trying to just build that strength back up and that stability. I was also doing things like standing on one leg. I do this a lot anyway. Again, great for your core, great for that proprioception, how your body perceives itself without you looking at it, right? Cleaning your teeth, stand on one leg. That gives you a couple of minutes of that strength. Washing the dishes, standing on one leg. So these were some things I was doing again, just to build that strength and balance back up. And then I went slowly back into fast walking, hill walking. I went on the bicycle. So by about week 2, I was going out and doing a very light jog. I was doing sort of a minute on, a couple of minutes walking. By week 4, I was running again. So these exercises with the band, I was doing pretty much every day. That's the idea. You do them every day. You would do maybe 2 sets of 20 of everything. So by the time you're getting to weeks 3 and 4, you can start adding weights and doing kind of, squats, weighted squats. So you could do front squats, deadlifts, etc., and building that weight up. So then you can slowly build yourself back up to that harder motion of running. By week 6, I was fully back running and training for the half marathon. So definitely work hand in hand with your physician and physio if you've got one. These are just some things that I did to rehab my knee, and I hope they help you.